Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. We got some really interesting segments today. First off, today's teens, based on a new study, are actively planning on having plastic surgery. This is a big change from the past. We're going to talk about that. Then, the rising cancer rates in young people. What's causing it? What can be done about it? We're going to unpack it. And finally, we're going to talk about the rising incidence of people removing breast implants, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me today is not Sarah. We do have a returning co-host. This is my daughter Danica, who's filling in for Sarah because she had to leave town kind of unexpectedly for work. So welcome back, Miss Danica. It's a pleasure to have you back. In the box, we got Travis as always. What's up, man? How's your Friday?
Good. How about yours?
Doing good, man. It's a Friday, so it's always a good day. If we're doing the show, it's Friday, which means it's good.
Absolutely.
Yeah.
Absolutely.
Well, Danica, thank you so much for returning. We actually have a pretty good topic because we're talking about both a teen topic, which you fall into the demographic of this one, barely. And then also we're going to be talking about a segment about young people. So, and also you like medicine stuff, right?
Yeah.
You do? Because, I mean, you've told me in the past you may go into a career in medicine.
Yeah, I want to either be like a neurosurgeon or a trauma surgeon.
Neurosurgery or trauma surgery? Wow.
Yeah, that's really cool.
That's very, those are very high power, stressful positions. You think you can handle the stress?
I can handle school, I can handle this, so.
Right
That's
on.
a good thing. I mean, just knowing you, I think that you will have the kind of attitude that you can handle that kind of stress.
Thank you.
Because you seem very good under pressure. I mean, you do good like on live, TV, right?
She's gonna crush it.
I think you do really good with that.
Thank
so,
you.
all right, well, excellent. Well, why don't we jump into some segments? And the first one is a segment that is about teens, and this is from a brand new study. And I think this actually will see more of this on social media and the news very quickly because it's kind of a shocking statistic, and it just hit like day before yesterday. This is from a Newsweek article, and it's about today's teens actively planning on having plastic surgery. And that's something new because in the past, I mean, if you ask teenagers about plastic surgery, they probably wouldn't have any real comment about it.
Yeah.
And so this is some pretty new data. And you and I think, we actually talked about something similar the last time you were here because we were talking about Gen Zs.
Oh yeah, I remember.
Yep, because Gen Z is 12 to 27 and you fall into that. You're on the younger end of it. And how Gen Z was embracing both plastic surgery and aesthetic treatments. But a lot of the Gen Z are people in their 20s.
Yeah.
Because it goes all the way up until the late 20s. And so this particular survey, which I tried to pull up the actual study or the survey, and Newsweek kind of was very cryptic about where exactly it was, and I couldn't pull it up. So the data I have is from the Newsweek study. But it said that in teenagers ages 13,
Me?
that's you, to 17 years old, so we're talking like young to middle teenagers, 1 out of 4 plans on having plastic surgery in the future. And I thought that number was pretty surprising. When you look at like the average population, if you poll every person in the United States and say, okay, how many of you people are planning on having plastic surgery, do you think the number would be higher or lower than that?
I think it would be lower.
You would be right. Yeah, the number is way lower actually. It's only about 6%. Wow. So that means that teenagers aged 13 to 17 are considering having plastic surgery 4 times higher than the average American. I mean, that's what makes this data.
Crazy.
It's pretty crazy, right? And even more interesting in this study was that boys were slightly higher to say that they wanted to have plastic surgery in the future than girls. Can you believe
Really?
that?
That's
Yeah,
weird.
because that's crazy. Because when you look at like who's having plastic surgery right now, men versus women, it's like 90% women. And
Yeah, whenever I think of plastic surgery, I'm like, oh, women.
you're thinking about women, right? So I wanted to ask you, because you fall into this demographic. I mean, have your friends? I mean, and this may not be a fair question because I think your friends know what I do, right?
Yeah.
Okay. So have your friends ever talk about plastic surgery, like unrelated to me? I guess like when you say I'm going to go to my dad's office.
One of my friends says she wants to get a BBL.
Really? Really?
Yeah.
She wants to have a BBL
When she's 18.
When she's 18. Wow. Now, do you know how I feel? Do you know what?
You don't like BBLs.
You're very smart. Yeah, how'd you know that? Just from watching the show?
Yeah.
Wow, very good. Yeah. So yeah, I do think that Brazilian butt lifts are definitely, I mean, without question, they're more risky. I mean, the risk of death from those is pretty high. So I would encourage you to tell your friend to maybe reconsider. But she's got a few years to think about it.
Yeah.
So you had one friend that talked about having plastic surgery. Wow. Have you ever thought that maybe one day you want to have plastic surgery? I know it's probably not a fair question because we talk about it so much because of my work and the show.
I don't think I'd ever get like plastic surgery.
Okay.
Maybe like.
I don't think you need it.
Thank you. I don't know if it counts, but like maybe I get like a mole remover or something like that, but not like a Brazilian butt lift or like, you know.
Something like that. Something like aesthetic. Yeah. Well, that's good. That's a good attitude to have. And you know, who knows? You may change your mind one down the future. But it's good that you aren't like already set on something like that. And I think you would probably have a higher likelihood because we talk about it all the time just because of my job and the show and that kind of stuff. So that's great. So I want to ask you, and I know you're going to know the answer to this, but why do you think that teenagers 13 to 7 suddenly have this bigger interest in plastic surgery? What do you think is driving that?
To fit in like a beauty standard.
From what?
Like from shows or like idols or
stuff that you see
online.
Yeah, online. Yeah, absolutely. So I don't think that there's any question what's driving this big interest in plastic surgery and aesthetics in teenagers. I mean, nowadays it's just so common for teenagers to really be involved with social media. And I mean, I'm going to ask you this because I mean you're in this demographic. You're literally the best person to like have on the show for this topic. Do you ever look at some of the social media influencers or maybe musicians or celebrities and say, I want to look more like them? Does that ever happen to you?
Yeah, sometimes, but like it's not like a really bad thing, or like it's not like I need to look like them or else I'm not pretty.
Right.
But it's like they're really pretty. Like if I look like them, that would be cool.
And I think that I find you to be a very confident person, and I think that probably affects your answer to that question a little bit more than some people. A lot of people in your age bracket aren't confident. I'm sure you probably know that, and so they see this stuff on social media, and unfortunately, especially young people will get the idea that this is the expectation, right? That these people that are portrayed in this perfect way, they might be using filters. That's a big thing on social media to get rid of all the blemishes. And so, they may look at all these people and think, well, this is what I have to look like to fit in. Yeah. And I think that's bad. I mean, it's making this unrealistic expectation for kids. And I've talked about this on shows in the past, and I'll ask you if you've ever heard me say this to you, that parents need to talk to their kids that are on social media about what you see is not real life.
Yeah, I know.
Yeah, I mean, have we talked about that? I think we have. Like in a roundabout way.
I think I don't really use social media much for like pictures and stuff. I mostly just use it like show like my interests or like things I collect and stuff.
Yeah, because you actually are posting stuff on social media. A lot of people just absorb, because on social media there's creators, like me. I create a lot of stuff on social media.
Yeah.
And then there's people who consume social media.
Yeah.
So, and I do think it's interesting in this survey that talked about the big increase in teenage boys thinking about plastic surgery. That's pretty wild. And the article had a few things to say about that, which I thought were pretty interesting. Based on like some psychology studies, there is this kind of thought process in some younger like males that there's this fear of men dying alone. And so they think that perhaps we're seeing more increase in males seeking plastic surgery because there's this thought process that if I have my best, appearance forward, meaning, if I look the best I can, then the chances of me being alone or less, which I find that to be very sad, that there's this thought process. Because that was something that growing up, I never thought about. I never thought, I have to go out there and, find someone or I'm going to die alone.
Yeah, me too. I don't think about that. I'm just kind of like, YOLO.
YOLO. Very good. Very good. So also with the males, there has this been evolution lately in the past decade of gender norms kind of breaking. Like when I was growing up, a boy was, expected to be rough and tumble and, not be concerned necessarily about, how they look. And I do think that has changed. I mean, there has been. Yeah, you think so?
Yeah, I feel like boys now care a lot more about their appearance than they did. Well,
maybe in recent past. I mean, when I was growing up, there was a lot of people that did care, but then I felt like that changed, and like in the early 2000s or maybe early teens, there wasn't as much care about necessarily how people looked.
Oh yeah.
But do you think that's changing now? Do you see the boys in your school that they
I
care
was
more about how they look?
really good friends with this boy a few years back, and he had this cool hairstyle that was kind of a side part.
Yeah.
And then randomly, the day after 7th grade, he just totally changed it, and because all the boys in my grade had a different hairstyle, and he changed it to that, and I was like, oh, well, okay.
Yeah, that's putting a lot of thought into your hairstyle, and I totally get that. I mean, I think it's cool that kids are. Care about their appearance. I mean, if it drives them to plastic surgery, that's obviously not a good thing. But it is kind of cool that people are caring about how they look. So obviously, the concern with this new survey showing that plastic surgery desire for teens is way, way higher than it's ever been, and dramatically higher than the kind of national average, is the concern that we are, and we've talked about this so many times, that social media is setting these unrealistic expectations for beauty. I do think it's very important that parents talk to their kids about that because as we just talked about before and we've talked about in the past, I mean, social media is not real life. I mean, it's filters, it's people only putting forward their absolute best side, or they're doing things to make themselves look better and not telling people about it. And then people expect that, that's normal. And it's just not the case. I mean, so much social media is just fake, not real.
Yeah,
So
I
do you agree
agree.
with that? Yeah, okay. So I dug up some more interesting stats about plastic surgery in teens because it is on topic. Now, this is separate from the Newsweek article. I'll throw up that Newsweek article, Travis, if anybody wants to look at this. So here it is. It just came out night before last. So this is a brand new thing. I think we'll probably see this hit the national media, I would suspect. Probably in the next week or so, about America's teens already planning to get plastic surgery. That's
We're ahead of the game.
I know, we make the news here, right? Right, Travis?
If we don't make it, we break it at least.
We make it and break it. That's
Yes,
right.
indeed.
Awesome.
Yes, indeed.
So I want to pull up some stats just on plastic surgery in teens because I think it is pertinent to this discussion. So right now, teens. So we're talking, people younger than 20 account for only about 3 to 4% of cosmetic procedures. So that's pretty low. I would expect that to be the case. We haven't seen a huge rash of teenagers getting plastic surgery, even though it increases slightly each year. So 3 to 4% of procedures equals about 250 to 500,000 procedures, though.
That's a lot.
Yeah, it is a lot. Now, here's the good news about that, because those numbers are big, right? And if you thought that 500,000 teenage girls were going out to get breast augmentation, that would be very, very worrisome. But when you dig into the statistics on that, the plastic surgery that they're mostly getting are what I would consider appropriate plastic surgery. So instead of people, teenagers running out and getting liposuction, they're going out and doing things like correcting nasal deformities, so like nose jobs. And so I see that as a little bit different than aesthetic, because in that instance, someone is not trying to make themselves look better. They're just trying to make themselves look normal, because a lot of people will have a nose that they might be bullied for, or maybe they have issues breathing.
Yeah, I know a girl in my grade who has like a more like Roman and like German nose, and like some people like are really mean to her, and I think that's rude.
Right. Yeah. Exactly. So, and that's a classic example of somebody who just because of the luck of genetics or whatever, they have something that is a variance from the normal.
Yeah.
Right. It doesn't look just like a normal nose. It looks so different, and that can be very hard for. It can be hard for anyone, and especially kids, because kids tend to focus on that. Like their peers will focus on it and maybe give them grief or bully them for that. So rhinoplasty or nose jobs is one of the big ones. Another one is gynecomastia. Do you know what that is?
I think, but.
So gynecomastia is when a boy gets breast tissue like a girl.
Oh, yeah.
And it's actually fairly common. It's not something that's rare, and it can be very hard for a young man to have that, because if they're in the locker room for sports and they look different, people will focus on that.
Yeah.
So nose jobs, gynecomastia, otoplasty, so that's ears. Have you ever seen somebody that's got the ears that stick out really far instead of being flat? So otoplasties are very common. Mostly that's done in younger people, but sometimes done in teenagers. And the other one that's really popular, which I think is legitimate, is breast reduction, because there are teenage girls that just due to genetics get breasts that are so large that they can't do sports.
Oh, yeah.
Or they can't wear clothes. And so, I see that those plastic surgeries are a little bit more
reasonable.
They're a little bit more reasonable, right? Like
Yeah.
if there was that many teenage girls going out and getting, liposuction, I would be worried.
Me too.
But these seem like pretty legit surgeries. So, and talking about, breast augmentations, like less than 1% of all breast augmentations are done on teens. Now that does include like 18 and 19 years old who are technically adults.
Yeah.
So, even that's going to be older teens, not younger ones. And you were talking about bullied. It says that 1/3 of teens that get plastic surgery get it because of bullying due to their appearance. So, yeah, some interesting facts. I do think it's a little bit sad that social media is maybe driving kids to think they have to have plastic surgery. And I say that as a plastic surgeon who, obviously it's good for business if more people want plastic surgery. But on the other hand, I don't want people to, have, mental health issues because they're obsessing about it.
Yeah, I feel like if you're gonna get plastic surgery, you should get it because like you are still confident, but you want to be more confident.
Right.
And sometimes people would want to change, but like you shouldn't get it if like you're like, oh, well,
You feel
so and so
you
thinks
have
I'm
to
ugly.
get it. Yeah, because you have to get it. Yeah, and actually there's some really good data on people's confidence levels after they get plastic surgery, and across the board, people's confidence in their self-image does go up. So I think there's definitely like a good place for plastic surgery out there. I just get a little nervous when people so young are thinking about having it. Outside of those specific ones that are kind of common now, where it's not really cosmetic, it's more just to make them normal and fit in with their peers. So.
Yeah.
Well, interesting stuff. You'll have to ask your friends and say, hey, we did this segment on my dad's show about teens and plastic surgery. What do you guys think?
Yeah, I'll let them know.
You have to give me a full update. So, all right, let's move on. So, another topic about young people. Now, this one is not necessarily about people as young as you, but it is about young people, and this is about the pretty clear evidence that there's rise in cancer rates for young people. And so when we talk about young people and cancer, we're not talking about necessarily 20-year-olds, but we're talking about people who are younger than kind of the normal age for people to get cancer. Because do you think cancer is normally a problem for older people or younger people?
Yeah, old people.
Yeah. Most of the times you're right. Now there are childhood cancers, that is a thing, but in general, most cancers are for older people. And if you look at the research on cancers, it's pretty clear that overall cancer deaths per year are falling, which is good. That means that we're doing good cancer treatments for people. We're detecting cancers earlier and we're treating them, and there's less deaths. But what is concerning is when you look at the data, new cases are ticking upwards, meaning we're seeing a slight rise in cancer from year to year, and many of those are in younger people. And so there was a 2024 study by the American Cancer Society which showed that from the years 1995 to 2020, so that's a 25-year span, young adults were the only age group who had a clear incidence increase year to year, and it was about 1 to 2%, which that's not a huge number, 1 to 2%, but it's every year over 25 years. That's a 25 to 50% increase.
That's a lot.
Yeah, it is a lot, and so that is a little bit concerning. And those cancers are known as early onset cancers. So we don't say young people cancer. There's actually a term for it. It's called early onset cancers. And the definition of that varies by the type of cancer. So for like breast cancer, they consider early onset younger than 45. You know, breast cancer is something that greatly affects women. I'm sure even as a young person, you've probably heard about breast cancer, right?
Yeah. There's a lot of like things in my school where it's like, it'll be like a peace sign or whatever sign that is, and it'll be like pink for breast cancer.
Right. Yeah. So even at your age, you've heard about that. Yeah. So like early onset breast cancer would be younger than 45. You've heard of colon cancer?
Yeah.
So that's intestinal cancer. Early onset would be less than 50 years old. And the thing about these early onset cancers, they do tend to be a little bit more aggressive than cancers that an older person gets. Meaning if a 70-year-old person gets a cancer and then a 30-year-old person gets the same cancer, typically it's more aggressive in the younger person.
Oh no.
Yeah, right. So it's important that we kind of get to the bottom of this. Also, early onset cancers are more commonly associated with genetic defects. So do you know what that means?
Like, let's say you had like a disease or something, then whenever you had a child and had me, then I had the disease.
That's right. And so in this instance, we're not necessarily talking about a disease, but you're on the right track.
Yeah.
We're talking about an issue with your genetics. Like, so for example, we have genes in our body that help fight cancer, and some people don't have that gene. And so that person would be more prone to have cancer. So that would be a genetic defect. As we said, they're commonly more aggressive, but they're also oftentimes more advanced. So what that means is we're better at picking up cancers in older people quicker than we are in young people.
That's weird.
Yeah, well, there's actually a pretty good reason for that. As we age, there are set guidelines for, okay, you know, I had to go and get scopes. Do you remember when I had to go to the hospital? And I had to get my scopes because I'm at that age where I'm just starting to get into the risk of things like colon cancer or whatever. So I went and got scopes. But like somebody that's 20 years younger than me wouldn't do that.
They don't think they need it.
They don't think they need it, right. And so we're screening older people much, much more heavily than we are young people. And hence, when we do have a cancer young person, oftentimes it's been going on longer because they're not getting screened.
Yeah, that makes sense.
And therefore it's more advanced. So the types of early onset cancers out there, we talked about a couple, but I'm going to go over the ones that are kind of the big ones. So they're breast cancer, prostate. So that's actually what my father died from, was prostate cancer.
Yeah.
Endometrial cancer, colorectal, and cervical cancer. And interestingly enough, colorectal cancer is now the leading cause of cancer death in men younger than 50, which is pretty crazy. Yeah, it's pretty crazy. So obviously everybody wants to know, why is early onset cancer increasing? And the exact reason isn't really known, but there are some research out there that kind of give us some insight, so I wanted to talk about that. Have you ever heard of something called biological age versus chronological age?
Yeah, I think so. Is it kind of like where, like,
You want to call in Travis?
Yeah.
Travis, you ever heard of biological age versus chronological age? Have you heard that term before, at least?
I've never heard of that term.
Okay, all right. That's okay. I mean, it's something I've heard of, but I obviously read a lot of research papers. So our chronological age, okay, I'm 49. That's my chronological age. But there are tests you can do to determine what your biological age is, meaning even though my actual age is this number, am I healthier than average, where my biological age might be 35?
Makes sense.
Or have I lived a very hard life where my biological age might be 60? And so there are certain markers that you can look at, and it's mostly looking at things revolving around like your DNA, like your chromosomes, your cellular metabolic activity, and there are some research out there that's showing that young people today have a much higher biological age compared to their chronological age when you compare them to people 20 years ago.
That's weird because
Go ahead,
because
sorry.
I feel like that like 20 years ago things were still kind of changing. So for like some people it was like harder, like maybe people who are like gay or something, because like they weren't really accepted. So I get that would kind of be like, oh,
So
like,
the stresses,
make 'em sad.
right? So you're
yeah.
talking about things like stress, right? Because for gay, lesbian people, like 20 years ago, weren't as accepted. Now they are. So you would think they would have less stress.
Yeah.
But I think more importantly, I mean, because stress is one, and so something like that, if there are people who feel marginalized, like hopefully today they're better than they were in the past, because I think our society is moving forward
Yeah,
on
I
these
agree.
things. But they're looking at some other factors for why biological age might be increased. And so there are two important things that are rising in our society that affect our biological age in a negative way. One is obesity.
I was gonna say that.
Oh, you were?
I was
Oh,
like,
sorry, I
I
didn't
think
mean to
it's
steal your thunder.
obesity.
Yeah, so there is a tendency, at least here in the United States, that people are heavier than they were in the past. And so if you look at the 10-year rate of obesity, so 2024 to 2014, there's a 22% increase in the rate of obesity today
Dang.
versus 10 years ago. I mean, that's a pretty significant number just to be the increase. Diabetes is the other one. Are you familiar with diabetes?
Yeah. One of my friends has diabetes.
Really? Oh, so type 1 diabetes. Okay, so you know something about it. So when you look at 15-year data, there's a 33% increase in
Dang.
diabetes from whatever that would be, 2009. And so I do think that probably is at least partially weighing in on this increase in cancer in young people, because when you look at a lot of these cancers, things like diabetes, things like obesity, smoking fortunately has gone down, but people still do smoke. Alcohol intake is also in there. Some of these factors are rising. And so I think that that's probably at least part of it, and a lot of research would kind of agree that
Yeah.
if rates of these diseases are going up, then the rates of cancer, you would also see a slight increase. So the next question then would be, okay, well, how do we prevent this? So, all right, Danica, I'm always putting you on the spot, and I do this because I think that you have a good head on your shoulders, and you probably could come up with a good answer. How do you think that, do you have any suggestions for how we could prevent the increase in early onset cancers based on what we talked about? If you don't know, it's all right.
I think that maybe people should try and give young adults or students maybe a more stress-free
Okay.
work environment or school environment.
That could definitely help, because there are some biological markers that talk about biological age that are associated with stress.
I feel like that. So I know that bodies are really great now. Everyone's beautiful, but there's a difference between fat and obesity. Fat
Right.
is really pretty, and but obesity kind of gets unhealthy. So.
Right. So we should be very accepting of everybody, but
Yeah.
we also want people to be healthy.
Yeah, that's
Right.
what I mean. I don't want to sound like.
No, that's good. I mean, you're on the right track. So I mean, a lot of those things, some of those things I have. So healthy lifestyle, right? You're on that with. You said decreasing stress. That is important. Diet and exercise is important. I mean, there's a lot of data out there that shows that if people don't have a good diet, meaning that they eat foods that are bad for you, and we've talked about which foods are good or bad in the past on the show. Also, if the weight gets up too high, that starts to affect your health. And so, healthy lifestyle, and also that includes not using tobacco products and limiting alcohol. That does weigh pretty heavily on that, I think. There's two other things that you probably, just because you don't have a medical background, would know, like your family history. right? If you know that you have family members that have this certain type of cancer, that's important to talk to your doctor about, because that can change how quickly that you would get those screening studies for it. So that's an important one, is knowing your family history of cancer. And then the last one is actually going to the doctor. I mean, people are bad about going to the doctor. I include myself in that. I had been talking about going to the doctor to get my appointment, to get my scopes done for literally, years before I finally did it, just because I'm busy with work and I didn't necessarily want to do it. It was something I had to do. So I think those things are important. Know your family history, go to the doctor regularly, and doing your best to have a healthy lifestyle are big ways that we can potentially slow down this rate of early onset cancer in young people.
Yeah.
Yep. All right. Very good. I appreciate you weighing in on that. Okay, now, the last topic I don't think you're going to be able to weigh in on too much, but you're welcome to ask questions about this. So the last topic for today, and this one is pretty interesting, and I see this in my own plastic surgery practice, is the increase in people wanting to remove breast implants. This is something that has actually, I've seen visually grow in my practice over the years. Now, I'm going to tell you that breast augmentation surgery continues to be one of the most popular plastic surgeries in the United States. It's actually number 1 or number 2 each year. There's around 400,000 done every year in the United States, which is a pretty big number. I do think that overall they're really good surgeries when you look at things like satisfaction rate, easy recovery, low risk. I do think they are good surgeries. However, we have seen a pretty significant increase in the number of women who come back and want to have breast implants removed. And so, that's not too shocking, because, if you have breast implants put in, they don't last forever. So at some point you're going to have to make the decision, do I want to swap them out for a new pair, or I just want to take them out? So
why don't they last forever?
Just like anything. I mean, it's like cars don't last forever, computers don't last forever, our clothes don't last forever. Medical devices are the same way.
How long do they usually last?
That's a great question. So it depends on if they're silicone or saline. Saline ones last usually at least 10 or 15 years. The new generation silicones are lasting a really long time. I think probably they're going to push 30 years or more.
Wow.
The old silicone implants of the past were lasting, 20, 25. So these things have, a pretty good lifespan to them, but they don't last forever. And so when they finally kind of give out, you have to do something. So what was more common in the past was for people to just swap them out for a new pair. And what we're seeing is the number of people, when they get to that point where they have to do something, they're actually taking them out versus replacing them.
How would someone, if someone got a breast surgery, how would they know that my breast implants are broken?
That's a very good question. So in the past, the way that we knew that is you would start to get scarring in the breast, and that breast would get harder. And so people would be like, oh, something's happening. And a lot of times that meant that they were having a rupture. Now, that was for implants that were older or saline implants. Nowadays, with the new generation silicone, it's harder to tell, because if they rupture, they don't necessarily cause a lot of problems. And a lot of people, I think, wouldn't even know if the implant did rupture. But when people go and get things like mammograms or CT scans for other reasons, a lot of times those radiographs or x-rays will show, oh, there's something going on with the implant. And then they'll get a report on that, and then they will say, oh, well, I have to go to a plastic surgeon to get that fixed.
That's interesting.
Yeah, so that's how people know. So the number of people who are deciding to go with implant removal versus implant replacement is actually going up, and it has over the last 15 years. And like I said, I've seen this in my practice. I would say in a given month, I get anywhere from 2 to 4 consults for people that want to remove their implants, which has gone up. That's a bigger number than I saw 10 years ago, for sure. And so the question probably pops up, okay, well, why is this? You're going to answer? Go for it if you think. Yeah, no, I know the answer, but if you think you know, go for it.
Maybe it could be since some people who have bigger breasts, they have more back problems, and let's say someone has a flatter chest, and then they get breast implants, they could be wow, this kind of hurts my back. I don't want to do this.
You're spot on. I mean, that's pretty darn accurate. So, Yeah, that's actually on my list here. So it is very common for, as we age, that we put on a little bit of weight. That's normal. It's a normal thing. And so for women, when they put on weight, some of it will go to their breast. And so what I've seen happen many, many times is someone gets breast implants when they're young and they're really petite and they're thin, and they get these breast implants, and then over the span of 20 or 30 years, as people tend to do, they put on weight and their breasts get larger and larger and larger to the point, just as you said, that it starts to become uncomfortable. And so there are plenty of people that exactly for the reason that you stated say, you know what, my body's changed, I don't need these breast implants anymore. And so they take them out. Another reason that somebody might do it, and I find this to be less of a reason, is for if they've had complications with their surgery. Historically, breast implant surgery is pretty low complication rate, but you know, there are risks of things like scarring or infection, and so if people have had a bad experience with them, they may come to the conclusion that they want to remove them. I've had that happen
That makes sense, yeah.
Yeah, I've had that happen from time to time where, you know, somebody comes in and like, look, I just have had problems with these since I put them in. I'm not interested in trying to, you know, fix it. I just want them out. So that does happen. There's two more reasons. One, change in desire for what people want to look like. You know, I mean, you know, I feel like I want to look a little bit different now than I did 20 years ago. Women are the same thing. You know, when women are young, they might be like, oh, I want to have these, like, you know, larger breasts. And then as you age, like, your desires change.
Yeah.
And so that's another reason why people change over time. And so some people just want to have them out because they want to have smaller breasts when in the past they want to have larger. And then the last one, which I doubt you've heard about this, maybe. Have you ever heard of the breast implant illness?
I think
I'd
I've
be
heard
surprised
it, like,
if you did.
Once, like maybe like one time scrolling on TikTok, but I don't know
Saw
anything
some on
about
TikTok,
it. Yeah.
Travis, I know we've talked about this. You've heard about this, right?
Mm-hmm.
Yeah.
I know we've talked about it
So,
before.
so in a very, very small percentage of people, we're talking less than 1%, that get breast implants, they have these kind of vague symptoms that they attribute to the breast implants. And there's never been really a direct link shown that the implants are causing it, but there is studies out there that show that if you have those implants removed, that those people will feel better. And so we don't see a huge number of people here in Texas that have it. I've taken out one set of implants for somebody that had breast implant illness. I had another person that had a consult for it just to maybe find out what the data was on it. But it is a reason. You see it in other places. It's a little bit more prevalent. So I thought I would talk about what is breast implant removal surgery like, because there are probably people out there that might be watching this segment and maybe they have implants and they're thinking about having them removed. So what is the surgery like? Well, it's pretty straightforward. We remove the implant in its entirety. So if it's ruptured, we make sure we get all the pieces associated with that. If it's not ruptured, it's pretty easy just to pull out. Then remove the capsule layer, which is that fibrous layer that forms around your implant. And that's the part that can sometimes scar and give people complications. So there's a lot of data out there that shows that you don't absolutely have to take that layer out. I personally do, just because I feel like it's better to heal if you have a fresh layer of tissue to heal together where that implant was versus that fibrous layer. So I always take it out. You will have drain tubes, so you do have to put a tube in that space where the implant was to suck everything together, to remove any fluid that comes in. The drains usually come out very, very quickly, so it's not like other surgeries where you'll have drains for weeks and weeks. They usually come out pretty quick, like in a couple days. Recovery is overall very easy for these surgeries. It's not a bad surgery as far as how much pain you'll have or having to take a long time off work. Overall, these do have very low risks. I can't think of anyone offhand that I've taken implants out that have had problems. I'd say they also have a very, very high satisfaction rate. For my patients I've done these for, across the board, I think they've been happy. The only thing to consider about when you're removing breast implants is what do you want to do to your breast, if anything, because if you take something large out of a breast, like a breast implant, the shape of the breast tends to get worse. It's just like the same phenomenon when women get pregnant and their breasts get larger and then they lose that weight and the breasts have a shape that's not as nice or as perky. The same thing happens when you remove breast implants. So for most people, they will remove the breast implant and then do a lift to reshape the breast and make it look nice. And so it's definitely important to have that in consideration. And so moving on to that, talking about tips for people that are seeking breast implant removal, I have some things I think are very important. First off, find a plastic surgeon, make sure it's a board-certified plastic surgeon that does a lot of breast revision. There are plastic surgeons out there where they don't do as much cosmetic surgery, and they may do like one surgery like this every 6 months versus people like me who specialize in breasts who do it all the time. You want to find someone that's going to listen to you. I have had people come in who either wanted to have their breast implants completely removed for one reason, and after we discussed it, found out that maybe that's not what they wanted. Or I've had people that maybe wanted to just change out their implants that really didn't need them anymore. And so you want to make sure you find a plastic surgeon who's going to take the time to talk to you about what it is that you're trying to accomplish, because it's not the same for everyone. I'm also a little wary of people who claim to be breast implant removal specialists. That's not really a thing. There's no fellowship for breast implant removal. It's a marketing gimmick, and when people do marketing gimmicks, it always makes me wary. So, I mean, obviously you want to find somebody that does a lot of breast surgery or somebody who's done a fellowship in breast, but breast implant removal specialist is not a real thing. So, also finally, tips for avoiding being that person who would want to have their breast implants removed in the future. So this is for people who are thinking about having augmentations. First off, find a good, talented surgeon to do the augmentation, because people who do lots of these tend to have better outcomes, which means you're less likely to have complications. They're also more likely to talk to you about the potential downsides of getting really big implants, which if you get really big implants early on, you're much more likely to want to have them taken out down the road, or at least downsize them. And then the last one is, as Danica was talking about, is making sure your weight doesn't get out of control. If you gain a bunch of weight and you have breast implants, there's a very high likelihood that you think your breasts are going to be too large, and you'll be much more likely to want to have them removed in the future. And Danica, this is kind of a funny thing. What's the saying we say about breasts?
Sisters, not twins.
She heard me say that one time, and now she's running around her school saying that, and apparently like it's a meme at your school. Is that right?
Yeah, a lot of people say
And she wants me, what do you want me to do?
You should make merch.
She wants me to make merch
Merch
that says sisters, not twins,
That would be dope.
which I think I'm actually going to do, because I think it'd be funny even if we don't get rich selling it. So, well, I think that might be all the time we have today. I want to thank you, Danica, for coming and being a guest co-host. I think you did an awesome job. You're great on camera.
Thank you.
Thank you so much for coming. Thank you guys so much for tuning in. We really do appreciate it. Please leave us a comment. We want to know what you think. Maybe we'll talk about what you want us to talk about next time on Nip Talk.